Almost certain there will be more cases in the UK, probably a lot more cases, as the Prime Minister laid out, and we would expect some deaths. With all epidemics, what happens is they start off very slowly and then they gradually gather momentum and then suddenly go up relatively fast. Now, we usually have a reasonable period of warning before that happens, and we are modelling this out quite carefully. From the time that we get established transmission in the UK, if we get established transmission in the UK, which I think at this time is more likely than not, then there will be a number of weeks, probably about 6 weeks, before we start to see a significant amount of transmission in the UK. In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk almost not at all. So we do not advise that. The only people we do sometimes use masks for are people who have got an infection, and that is to help them to stop it spreading around. It's important for government and for society to plan for the reasonable worst case. And for the planning for the reasonable worst case, it is sensible to start with the possibility that up to 20% of the population are sick at one particular time. But that's not a prediction of what will happen. That is just the upper range of what might happen.
And obviously, I'm not now registered because you give it up when you retire. There's got to be some quick and safe process to get us all re-registered now, not in months' times when it's too late, so that if we're wanted, when we're wanted, we're ready to go.
And you've been out of the game for a few years. Are you ready to go back to work?
Depending on how, what they want us to do and how they want to play, obviously could consider that. But I think I could, yes, I could pick it up quite easily.